Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thanks for tuning in. And today we're coming to a close with the arc of episodes we just did on self silencing or silencing the self and women and the impact of self silencing on women's health. I want you to know when I researched this. I spent a lot of time researching this. I love researching this. This is one of my favorite things to do is research and read the literature. And I want you to know many of you have, autoimmune conditions, and many of you have fertility issues and cardiovascular disease and weight control issues. All of these things that are deeply associated with self-silencing, the way that you were raised and conditioned to interact with the world. I want you to know the thing is like the physiological symptoms that I'm talking about that I'm treating here and the way you were raised and the impact of how that affects your approach to the world. The two schools of medicine don't interact at all. There's little to no discussion in the literature for cardiovascular disease around self-silencing and its impact. There's little to no research or research and courses to teach physicians, because we all take continuing education courses. There's little to no discussion on how any of these pathologies that we've been talking about are associated with and intertwined with silencing the self. Now, I know some smart aleck physician will come back to me and say, that's because they're not. They're not because they haven't been proven that way. And that's a cop-out. Always has been and always will be. How I came to this place of understanding, it's not because I just, wanted to be novel and fancy. I know people that do that. They go out there trying something novel and fancy so they can make their mark in the world. That is not my approach at all. How I came to understand this is being in the room with you for all of these years and listening to you and caring, truly caring, and then applying a scientific mind to what you bring to me. So when a patient presents to clinic and she has, all of these symptoms of autoimmunity, and I'm trying to get to the bottom of why, spending the time understanding how she's come to this place of stress in her life and the impact this stress has on her autoimmunity, that's just natural medicine. That's how medicine should be. If your patient presents to clinic with autoimmunity and stress is a component, and it is a component, and it's a woman, and you run your labs and you see the markers of stress readily available right there on your labs, then you sit down with the woman and you say, I want to understand you. I want to understand your stress. I want to understand how this comes about. Because as a physician, when you have the woman there in front of you with autoimmunity, it's not enough to just prescribe the medication du jour. That's not enough. This woman is trusting you to use all of this. So she comes in with autoimmunity, and it's stress-induced. You run your labs to see that. You need to now understand how the stress is happening. What's the cause? How can I be helpful in that moment? What can I be? And then when you have that long conversation with her and you've earned her trust and she starts sharing with you her history, her relationships, how she communicates with others, and you see self-silencing in this woman, then you start crossing over to becoming, I believe, a true physician. Because now you're looking at the cause. You're helping unravel it. You're prescribing the medication necessary on this end to stabilize her and make her well. And you're trying to reverse any pathology, which I'll go over today. And you want to stop it from progressing. If we don't address the cause of the disorder, it will only progress and get worse. If you take a person who is pre-diabetic or early type 2 diabetes and give them metformin and send them out the door without any kind of dietary work at all whatsoever, what happens? Over time, they need a higher dose of medication. Over time, you put them on insulin. Over time, they have more and more pathology associated with it because you never treated the cause. That smart aleck physician doesn't seem so smart anymore, do they? No. A smart physician, I believe, is a loving and caring physician. Truly. So today's episode, I want to drill down a little bit and close out the series, focusing on some therapies you can do to further stabilize your case. I'm going to be very science driven. I'm going to talk about the metabolic pathways. I'll be very clear with you. I want you to understand where this falls in the therapeutic order for you as a patient. When the patient presents to clinic with an autoimmune disease or cardiovascular disease or infertility or metabolic condition like weight gain, we need to stabilize the person, valid, and we will prescribe to that. And that's well documented. I'm not going to spend valuable time going over those therapies. Those therapies are in place. We know what to do. We know if you have high cholesterol, there's therapies I can use to bring them down. I know this. And I know that the person has, type 2 diabetes. I know what to do. There are things I know in autoimmunity. I know what I need to prescribe. Good. If the patient comes in and I'm doing my job, and I'm doing good work, and I've come to the understanding they're self-silencing, I'm going to refer them to therapy. Absolutely. Absolutely. And if the patient cannot afford therapy, I'm going to prescribe as many different methodologies I can find that they can afford, that can integrate into their lives to help them work through self-silencing. Books, podcasts, whatever it takes for this woman. I got to meet her where she is. It takes years to undo the pathology of self-silencing. It takes years of therapy for some of us. It's worth it. But during those years of therapy, I wouldn't be a good physician if I wasn't trying to stabilize them as much as possible. Again, I want to treat the cause. Therapy is the way to do it. But there's another part of cause I can be treating as well in the meantime to stabilize her. And I sometimes liken this to being like a pit crew to a race car. She's a race car. She's getting around that track, and I got to make her able to get around that track at the best time, at the safest and healthiest way. Just because you have not fully realized and effectively treated your history of self-silencing and your case of self-silencing doesn't mean you shouldn't be a mom, okay? It doesn't mean we should allow cholesterol plaques to continue to build in your body, moving you further and further towards a heart attack. It doesn't mean you should continue to gain weight. And it doesn't mean your autoimmunity should progress. So the question is, Brendan, what can you do to further stabilize me when I'm dealing with this? I'm doing my inner work here, getting better at communicating, talking to the men in my life about how I need to be heard, working it through in my relationships. Brendan, what can you do in this moment? I would say Brendan, but I'm Dr. McCarthy. But I like Brendan. I like having a personal relationship with you guys. But I'm a physician. You guys know I'm a doctor. I'm a real doctor. Oh. That's my next series I'll get into a little bit, but let's keep with this one. So I'm going to talk about individual things. In the case of cardiovascular disease, having that chronic self-silencing, that leads to increased cortisol. That also leads to increased epinephrine. Also, the epinephrine activates nuclear factor kappa beta pathways. This is inflammation. That cortisol and epinephrine, it's just natural to have that elevated when you're stressed. And when you're in a room with someone who's just, talking over you, telling you what you want, what you do, controlling everything you think, like trying to have total control over the space around you, you're not allowed to have a voice. Anytime you say something, they're going to, shut you down, or you're raised that you're not supposed to speak up. That's that cortisol epinephrine thing happening. And a lot of women don't even recognize it happening anymore. They're so used to it. But still, These cortisol surges, this epinephrine, which is part of the fight or flight reflex, that's the adrenaline part that happens when you're stressed out. That's going to stimulate more nuclear factor kappa beta pathway. That's going to be more inflammatory. You need the response. It's a part of being alive. It's important to do it. And the old-fashioned way of treating it was they would just suppress it, put you on Valium or something. That's what they did. And Xanax, later Xanax, which is a big thing in the 90s. This is not good. It leads long-term to addiction. So what I'm going to talk about is a little bit better of an approach. One is using therapy to help modulate the cause, get your brain to kind of rewire a little bit the way you approach communication. But on mine, what can I do? The first thing I recommend for women is to use a heart rate monitoring device that specifically looks at heart rate variability. Heart rate variability has to do with the way your heart is beating. Now, your heartbeat should be at a certain rate, of course. And the heart rate is not what I'm talking about here. It's the variability, the time between each heartbeat. Think about the heart rate when it's beating and you're totally relaxed. Your heartbeat is going to beat, and there's going to be a little bit of variability between each beat. So the distance between each beat will be a little bit longer and shorter, back and forth, back and forth. And I kind of think of it as like, just body's just relaxed, everything's calm. This is weird. I'm gonna say it anyway because I can. It's like having kids in elementary school lined up to go to the cafeteria. They're kind of like wandering around. They kind of do what they want. It's just kind of relaxed. Like, yeah, well, get over there now. No, oh, you get, if you ever hang around with kids, this is what they do. That's great. That's relaxed. That's a relaxed heart. It's a happy heart. It's like kids run around having fun, right? There's no thing. Then when there is stress introduced, think of that as like a military thing where the military gets lined up and they're in direct order. What happens? The heart rate variability, when you're like relaxed, it's a little bit varying, right? But once you start being stressed, your heart rate variability tightens up. You become more rigid. The beats bump, 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 bump. The reason why is everything's getting lined up so that way when stress happens, your heart is ready to line up. It's being tensed up. It's like the runner at the start of the track. It's all tightened up, ready to start firing and running. So everything's it's like a pre-clench kind of state. That's what heart rate variability is telling you. So I have people wear an Oura ring. I didn't wear mine today. It's on the charger. Oura ring. You can use different watches. There's different tools. You want to have it staying on your hand all the time or on your wrist all the time. You don't want to have the one where you just touch it to your screen on your phone. They have the little sensors you can buy on your phone. Don't use those because that's just going to be just as you use. It's very periodic. You want something that you're using regularly that stays consistently monitoring you. And what that's going to let you do is you're just like being able to perceive when you are more stressed. A lot of us are dissociated from our stress. We don't even know when we're stressed anymore. We don't recognize it because we're just used to it. It's like that frog in the pot analogy I used in a previous episode. We want you to start understanding that. So you use that tool to track stress. And this is important because the therapies I want you to do are going to be directly targeting the way you respond to stress. So using a heart rate variability tool like an Oura ring, and there's no affiliation with any of these companies, by the way, you guys. I have no money comes from me to them, and nothing back and forth. I bought my ring. I'm not a influencer trying to grab some money or some stuff, But if you are at Hum Kombucha and you see this, know that if you sent me a case of kombucha, I'll talk about you. All right, back to this. I'm using heart rate variability, and then you can start doing something that was popularized on the internet a couple of years ago. It's cold plunging. Now, cold plunging had its moment. It was hot for a while, and now it's not as hot as it used to be, or cold. It was as popular, right? The thing about it, though, is why were people doing it? A lot of people hype it and make it out to be something more magical than it really is. Heart rate variability can be tested when you're cold plunging. So what you do is you get into a cold plunge, you jump into one of these cold. There's a lot of places that offer cold plunging suites, but you do cold plunging and you see what your heart rate variability is doing. What you should see is your heart rate variability improving, getting more variable in there. The sympathetic is being downregulated. That's great. Now, some of you, I know women, don't like jumping in cold water. I get you. I'm with you. You could do, this is awful. Face plunging in cold water too. Get a bowl of ice water, put your face in it for a little bit. That helps, but it's not popular. Another one is just cold packs on your neck, right here, right at the vagus nerve, right there, at that ganglion right there. Just keep it there. and use your ring to see, or whatever you're using to test heart rate variability, to see. This is physical medicine. This is physical medicine you're doing here. I know there's a product I just saw being advertised that's a vagal stimulator. I have no idea if it works or not, but I just cold plunge, cold packs on your neck, and just watch to see what heart rate variability does. This is not an expensive therapy, cold ice packs on your neck. So you do for like 20 seconds on, 2 minutes off. That's one way of doing it. You know, you take a moment, Google different therapies, different techniques to do this. We have a different sequences we do in our office. Try different ways of doing it just to see if it works. That's one thing you can do. Box breathing is another, where you breathe 4 seconds inhaling, 4 seconds hold, 4 seconds exhale, 4 seconds hold. That's that box breathing you can do. That's another one. See if that moves your heart rate variability. These are things to try and down-regulate your stress, to get your body to break out of that stressful cycle. There's another therapy we do in office as well called a stellate ganglion block. And that's when they inject the stellate ganglion, which is right up in here, and they inject a little bit of anesthetic around that. Now, this needs to be done with ultrasound monitoring, and it needs to be done professionally. You know, and one of the physicians I work with, Dr. Danny Clark, does this in the office, and that is another great tool that resets that sympathetic parasympathetic balance and gets you better to have better heart rate variability, get your body to downregulate. Like, well, Brendan, why do I want that? Because that epinephrine, as I mentioned earlier, that epinephrine being surging like that, that's more pro-inflammatory. I need you to get more parasympathetic again. That parasympathetic, we're going to be more relaxed. What else can I add to this? Dark skin berries, blackberries, blueberries, boysenberries are rich in something called anthocyanins. And this is a compound that plays a role in that endothelial integrity of your arteries. And what that is when you have stress like this, it is pro-inflammatory to that endothelia, or the lining of your arteries. And that endothelia, that inflammatory state, it is really one of the most beneficial things you could do is bathe that endothelia with anthocyanins, basically putting in your diet more dark skin berries, blackberries, boysenberries, blueberries. We use this liquid. It's basically like all these berries mashed up, and it's like the step they take when they're making jam, without adding any sugar to it, and it's wonderful. Fruit anthocyanins is the thing is by Dr. Mitchell is the one who makes this. So anyway, that's a great product. We've used that extensively in the practice. It also lowers C-reactive protein, which is also a marker of inflammation in the body. So it's a good thing to be using as well. Thyroid optimization is important here, because when you're under chronic stress, that downregulates your thyroid function. Something called reverse T3 happens, and you have less of the active free T3, the free thyroid hormone. And the impact of thyroid on the heart is extensive. There's a ton of great research showing that when you have low levels of T3, your heart is less healthy. You have a higher risk for heart attacks and just general heart pathology. We want you to have better thyroid function. So I would run labs and verify how your thyroid is. I want to make sure I optimize that. Sometimes you don't need to give them thyroid medication. Sometimes you need to optimize the way they're converting their T4 into T3. So that would be selenium, zinc. And sometimes we'll use things like schisandra, which is an herb, or ashwagandha. Those have been shown to also improve that conversion of T4 to T3. But again, I don't prescribe these things unless I can prove they worked. Your trust is everything. Your trust is literally everything. And I need to earn your trust every single time you walk in the door. Every doctor should be earning your trust every single time. Every time. There should be no fat on that protocol, meaning you're not taking a supplement that's not doing something. I don't like any fat on any protocol I have. I want it to be all lean, exactly what you need, proven, and I follow up with it until you don't need it, and we take it out. That's good medicine. You're not taking something because I think that sounds good. I heard about that over here. My friend said this is good. No. You're worth more than that. It sounds like I'm talking about like magical medicine, doesn't it? It sounds like I'm talking about something that's like, who gets that? I treat school teachers. I treat mechanics. Some of my favorite patients, some of my favorite patients are mechanics. I love these guys. They've been with me since I started. You don't have to be rich for you to be treated this way. And if you're a doctor, you don't have to charge $1 million to do this. is basic medicine. This is basic stuff I'm throwing out. I'm throwing out off the top of my head, by the way. I have my notes to make sure I don't forget something because there's a lot of things I gotta go through and I ramble. I know I ramble. This is not magic. This is not special fancy medicine. This is the medicine you deserve. Let me keep going with this. Rapamycin. That's off the rails for a lot of people, it seems. I get pharmacists having a coronary when I prescribe this one. They do, I don't know why. They don't get me. That's okay. Rapamycin, yeah, rapamycin. I'll do an episode on it at some point, but rapamycin, specifically targeted using the correct amount, not overdoing it because too much rapamycin is immune modulating and it'd be immune suppressive. We have to be cautious how much we use. You have to use the right amount and verify it's working. But rapamycin inhibits something called the mammalian target of rapamycin, which is implicated in age-related vascular decline. So I'm going to use low-dose rapamycin in that person to make sure that I'm doing a good job with them. I'm going to monitor the white blood cells to make sure I'm not suppressing the immune system. And I'm going to be careful with it to make sure I did a good job with them. And I'm going to do that because you are worth all that effort. That's just some of the cardiovascular things I do. Not everything, but that's just some of them. Let's get into fertility. Stress suppresses the gonadotropin releasing hormone and ovarian axis. It just basically suppresses that pathway. And it's like, God's birth control. Stress is what's going to stop you from ovulating. This stress suppression in women, there's so much pressure on you around fertility. Self-made and also cultural and relationship. I see you. When I treat stress-related infertility from self-silencing, of course, still in therapy we go to any degree I can get. Progesterone is one of the most important tools I use in this situation. The most important thing I'm doing actually is progesterone because when you are stressed, that inhibits ovulation. That's not going to let you carry a pregnancy to term. You won't even conceive. If you do conceive, if you don't have enough luteal phase progesterone at the beginning of conception, a lot of times that won't last the first trimester and you will not be able to carry to term. This is when progesterone is very useful to carry that baby to term. We prescribe progesterone and I run the lab to verify you got enough. It's not right when a woman presents to clinic who's pregnant and there's a concern about them maintaining the pregnancy, that when a doctor just gives you transvaginal progesterone without a lab, without monitoring, that's not medicine. That's not good medicine. I never give a woman progesterone without a test to make sure I hit the right mark because there's a lot on the line. There's everything on the line. And if you cut a corner, the cost is high. You don't prescribe progesterone without a lab when you have a woman you're trying to maintain her pregnancy. You run the lab. You do your due diligence. Now I'm going to say this because there's going to be another, physician out there saying, well, when you do transvaginal progesterone, it's not going to be as high in serum because it's going to be more localized in the tissue. Yeah, I know that. And you know that. And we both know that. But that doesn't mean we don't run the lab. I know. And I'm fine with that knowledge that transvaginal will do that. But I still need to see serum numbers because I can at least infer something from it. Because it's better than nothing. It's better than just relying on what you think will work. Get your numbers. This is what she deserves. Testosterone. That sounds insane. Give them testosterone and they're going to be pregnant and the baby will have, chest hair when they're born. That's not how it works. That's not how it works. Okay. That's not how it works. Still, you don't do this with just any, halfway doctor. You want your doctor to be very competent in what they do. But yes, testosterone is helpful. Testosterone does play a role. Testosterone enhances follicle stimulating hormone sensitivity. It improves libido. It improves mood. But testosterone, when it comes to the intersection in your mind, when you perceive stress, testosterone gives you that drive. And we're talking women's dosing, not male dosing. We're talking dosing that is supposed to be physiological for you as a woman. So we want to get your dose up, your body level up to a normal physiological level for a woman. You will perceive stress through a different lens with testosterone. And what does that mean? When you perceive stress through a different lens, your body doesn't react as heavily. You feel more confident. You don't have the same inhibition of ovulation. Testosterone is a good tool. You need to be running labs, verifying you're hitting everything in the right numbers and being safe with it. Yes. And there are times to use it in fertility and times not to use it in fertility. But still, this is a tool that should be used and considered used. If it's contraindicated, we don't use it. But when it's necessary, damn, it works. It's a good tool. What else? Low cortisol. When you present to clinic and you have low cortisol in morning fasting, another way, it's not cortisol is an essential part of your health. There are times I need to prescribe low-dose hydrocortisone to get you physiologic, not super physiologic, not sub-physiologic, normal physiologic, the way you're supposed to be, following the circadian rhythm, which is in the morning you'll have higher cortisol, in the evening you'll have lower cortisol. When I give you cortisol, hydrocortisone specifically in the morning, targeted to be within the normal range of where you should be physiologic, hydrocortisone has a half-life of 2 hours, so it's in and out of your body as a normal surge of cortisol would be, so it matches what your body's normal rhythm is. And that plays a role with how your body responds to stress as well. That is a wonderful tool to use in that situation. And it also stabilizes the HPA, HPG axis, the hypothalamus pituitary adrenal axis and hypothalamus pituitary gonadal axis. It helps return that crosstalk back to normal. Again, it has to be physiologic, but it's going to help the relationship between stress and fertility kind of be back into balance. So it's important to use that tool when needed. And I have used it when it's needed. And I love it. It's great. Thyroid optimization. Thyroid optimization is also very important. I can't tell you how many women who are told they'll never be able to conceive, but the fertility clinic that, wants to push towards IVF never really ran a detailed thyroid panel or a really well thought out one. They just did a cursory look at it. Thyroid is the essential part of conception too. So I want to make sure the T3 is in a good level. I like 4, around 4, maybe 3.5 is the lowest I'll let it be, but 3.8, 4.0, 4.2, 4.4 is getting up there. Some lab companies, 4.8 is their highest. Some other companies, 4.4 is our highest. There's all over the place. And the reason why is as a species, we are becoming less healthy and the reference ranges seem to be lowering because of the averages, not because of what's physiologically right. So that's another cofactor in there as well. But still, we want to optimize thyroid. Another thing I put in here, and I forgot to mention with cardiovascular, I refer a lot to yoga. I'm a big fan of it. I'm a big fan of movement. I'm a big fan of movement that is thoughtful and that is meditative and that is healthy. I'm a 3-time Ironman. I used to do Olympic weightlifting. I love regular exercise as well. I'm not one of those people that doesn't do regular exercise. I do both. Yoga is exercise. Now, I know there's a lot of people who have different connotations with yoga, and that is what it is. But we do yoga, based on physical health in my office. We have a yoga studio in my office for that reason, because it's something that we refer to for so many years. And if we're referring to it all the time, we should be bringing it in-house. If it's something I believe in, I should be offering it. So we have yoga, and that plays a big role in cardiovascular health, but also in fertility, well documented in the literature. I thought I'd get away with one episode. It's not happening. So I'm going to do 2 episodes. I'm going to come back next week. We're going to go into how we treat weight gain, and then from there we'll go to autoimmunity and just different therapies we use in there that could be helpful in that setting. As always, your feedback means a lot to me. I'm not always able to fully respond to every comment, but please know I do my best to read the comments. I read the comments and I respond to the comments because that helps other women who have the same questions you do. Not everyone has the same confidence that you do when you write a comment. And I do my best to respond constantly. But your comments matter, and I do care, and I am thankful for them. To the degree that this episode helps, please subscribe. And to the degree you liked it, like it. And to the degree you think it will help someone, please share it. Thank you so much for tuning into this episode. I look forward to seeing you at the second part.